Hello and welcome. My name is Michelle Williams and I will be your instructor for this course. Let's face it, at one time or another, we've struggled with lowering our impedances. We've either had an elderly patient or confused patient struggling to get those last two electrodes to get under 10 kilo ohms, or maybe you've had a pediatric patient that has been sleep deprived and you're having to take that extra 20-30 minutes to get a couple of those impedances down. This session has been created along with a few of my other students that are trying to get a better understanding of impedances. There's two objectives for this session. The first objective is being able to actively being engaged in explaining what impedance checks are, their importance, and how they affect the EEG study. The second objective is to be able to assess the EEG impedance issue to be able to appropriately troubleshoot to resolve the issue. This information will not only help you provide better EEG studies, but it will also quicken your hookup time and then also help you to prepare for your studies if you are trying to get your EEG boards. If you go to ABRET's website, you will notice that for a EEG tech to prepare for their study, some of the fundamental concepts, including impedances, is listed. Also, troubleshooting skills is included as well. So let's go on ahead and get started. Now that you've learned the 10-20 placement and how to effectively apply electrodes, now I'm going to take a closer look at the scalp electrode interface. So as you can see in the diagram, all of the active synapses is going on at the top layer of the brain. For us to get to that point of picking up EEG activity, it is then having to go through several layers of the brain, through the skull, and then to the scalp. And that's where we start our preparation. Some of the adhesive that we use secures that electrode on the top, but underneath we need to make sure that we are using a abrasive prep gel such as New Prep, for example, to remove any dead skin cells, oils, or any products that can possibly impact the direct contact from the scalp to the electrode. The conductive paste that we use, such as 1020 paste, helps us attach that electrode so it's secure, but also facilitates a direct conductive environment for the brain's electrical current to go through the scalp to the electrode with minimal interference. What we're trying to pick up is electrical activity that's about 50 times smaller in amplitude than an EKG. So you can compare this to listening to someone who's talking in a quiet room versus someone who's whispering in the crowd, and then you're responsible for writing down what they're saying. The goal of a scalp electrode interface is to make sure we create a quiet environment that seals off electrical noise from other devices in the room and to reduce any other artifact that can impact the EEG. Some of the artifacts we cannot control, but as technologists, there are ways that we can use to reduce the artifact to improve our impedances. Your facility has probably given you an impedance limit somewhere between 5 and 10 kilo ohms, as many technologists have asked why this is so important, even if you don't see a big difference on the EEG. Digital equipment now can be used with advanced amplifiers to acquire the EEG, but the impedances still determine the authenticity of the recording. So the top portion of the diagram is a closer look at the scalp electrode connection, with the middle portion being positive and negative charges that are passing through the paste to the electrode that then is going to the amplifier. The second diagram at the bottom is a simple depiction of how the impedance is measured, with the current flow, which is the capacitance, being the material holding the electrical charge to flow against the resistance. This is measured by a small alternating current that checks how much opposition is going against the flow of the EEG. This is also why we do not check impedances with intracranial or needle electrodes. As the resistance increases, it is harder for the EEG data to flow easily through the electrode, and that also opens the door for other activity to contaminate the EEG study. Ohm's law is used to help determine impedances and show the relationship between the voltage, the current, and also the resistance. So voltage is measured in microvolts that you might have heard that is used in EEG to measure the difference in charges of 2 points. This information of the EEG will make the wave points upward or downward. The current is the measurement that is the rate of the charges flowing, and this is measured in amperes. So the basic equation for determining the relationship for impedances is R equals E over I. This is meaning that the resistance is the voltage divided by the current. This equation can also be switched around depending on what you are trying to determine, but for this session, just know the relationship between the three determine impedances. We are measuring impedances by the amount of resistance measured in ohms, and as it increases, the current and voltage has to work harder to pass through. I know that was a lot of information that we just covered, and at this time I want you to pause the recording and take 5 minutes to create an effective example that works for you on how you can remember the relationship between resistance, current, and voltage with regards to the EEG and its impedances. You can look this up on Google as far as Ohm's law if that helps to be able to make it work for you for understanding this concept. Earlier I mentioned that your facility has probably given you impedance level requirements that need to be under 5 to 10 kiloohms. This is probably based off of the ACNS guidelines that is requiring a minimum EEG technical requirement for impedances to be not below 100 ohms, but not above 5 to 10 kiloohms if necessary. So not only do your electrodes need to be low between those standards, but they also need to be balanced, meaning that they are all around the same level, such as the left diagram. On the right side, you have a couple areas that with high impedances that's in red, which means you need to probably work on a couple of those areas to lower them to an acceptable level. Now that we've discussed measuring the impedances, we now can see how impedances affect the EEG. In this study, the patient is in bed lying still, and as you can see, there are a couple of areas of electrical noise that's producing sharp vertical waveforms that look like artifact and blocking the channel's recordings. The high sharp waves are an example of what is called electrode pop artifact. This is just showing that the EEG electrode is unstable and not adhering well to the patient, which is disrupting the flow of EEG data and also allowing resistance from other external environments. The other artifact that's seen is called 60 Hz artifact, which is shown as the dark scribble-like waves that are showing. 60 Hz interference is a frequency from outside electrical currents that have somehow entered through a poor electrode contact to the EEG. You can see that the channels or lines that are involved are P3 and PZ electrodes. Each channel records between two electrodes, so even one electrode with poor impedances can affect several channels involved, which means if there's several electrodes that have poor impedances, this can obscure the entire EEG. This is another example of how high impedances can affect the EEG. Again, there's an electrode pop artifact that doesn't appear as obvious and obstructive as the previous sample, but has a rhythmic pattern of artifact that can be mistaken as a seizure by an inexperienced reader or by seizure detection software. You can pause this recording and take a moment to figure out which electrode has a poor impedance. If you said P7, you are correct, since both channels are recording from that electrode. This commonly happens as you are recording, and sometimes it's not clear if it's artifact or the actual EEG activity. The reading neurologist would not be able to confidently confirm if it's an EEG abnormality if it's recorded from a poor impedance. So this is why frequent impedance checks are so important with long-term patients that keep electrodes on for an extended amount of time. This next activity will involve your workbook if you have one, or a piece of note paper. You can pause the recording, divide your paper into 4 sections, and write down in 3 of those sections potential areas that can cause high impedances. Under those challenges, list some additional ways that these challenges can affect the EEG. Our last section will discuss a few suggestions for troubleshooting. The patient's skin preparation is crucial to low impedances for your study. If you determine that the skin needs to be reprepped, please make sure to take extra caution with repeated scrubbing to prevent any skin breakdown or injury. This is especially important for patients with sensitive skin, pediatric and neonatal patients, and also patients that may have other medical conditions that weaken their skin integrity. If your facility allows, you can use an alcohol wipe to remove conductive paste before you rescrub and replace the cotton tip applicators. This avoids spreading paste and also creates a non-greasy surface to rescrub. Another suggestion would be to hold the skin to prevent any skin dragging as you are cleaning the area. This will reduce any unnecessary discomfort for the patient and increase the actual friction with the intended area. You can use the side of the cotton tip applicator with slight pressure and only rub the area that the electrode is being placed. If you're able to, you can practice on your forearm to have a better sense of how hard you need to press down on that area so it's not causing discomfort. Here is another challenge for some patients when troubleshooting impedances. As you are practicing how to arrange hair so it's out the way for a good electrode application contact, consider using hair clips or braiding the hair in sections depending on the type of test, whether it's a short-term EEG versus a long-term EEG that may be secured with collodion glue to last a couple days. A few troubleshooting techniques that you could try are, as I said, using hair clips to section the hair if your facility allows, and then also to make sure that you are sanitizing those clips between patient use. If you are gluing or applying electrodes, make sure that they are all going the same direction as the hair flow. With long hair, I generally gather it so it's going over the neck roll if the patient's laying down and toward the top of the bed. Then I have all of the electrodes going the same direction. This prevents the electrodes from pulling away due to the hair being moved or if the patient's moving. In addition to that, you can also wrap the wires together and then also arrange the hair in a ponytail that's close that can help create a better electrode contact if the patient is moving around or sitting up in the bed. Another option is wrapping the head, especially with short-term EEGs, and then just making sure that the skin safety is not being compromised. Short-term EEGs can benefit from wrapping the head because it won't be wrapped for a long amount of time. If any of these suggestions are useful to you, you want to make sure to write that on your worksheet or your piece of paper under an area if you have hair listed. Going back over your notes, if you notice that you don't have equipment troubleshooting as a potential issue or challenge, please make sure in that last box to write down equipment troubleshooting, because some of these pieces could be an issue with your connectivity and your high impedances. You always want to make sure with your electrodes that you are checking the hub of the electrode and also the connector to make sure it's securely placed in the head box. Also, you want to make sure that your connector to your head box is secure And also that your reference and your ground electrodes have secure placement. And if those have high impedances, you want to make sure to assess those first. If those are intact and you are still having issues, you may want to ask another experienced technologist for some more advanced troubleshooting measures to improve your impedances and to make sure that your equipment is working properly. In summary, we now know that impedances is checking the resistance with that electrode to skin contact to make sure that the flow of brainwave activity can go freely to that electrode. We also know that that electrode and skin interface not only affects our impedances, but it also affects the EEG data that travels through the pathways to get to the EEG recording station. Once it's at that station, you can possibly have a couple of things that will affect the EEG quality if your impedances are high. A couple examples that were provided was electrode popping artifact, 60 hertz artifact, and also increased muscle activity. Last but not least, we then went over how to assess the situation now that we understand a little bit more about impedances when we're deciding the troubleshooting measures to improve our impedances. This can be with that skin to electrode contact, or it can be with the equipment. I encourage you, now that you are done with this session, to now complete the assessment. This will include being able to illustrate a chart of the impedances and then also how it affects different stages of the processing of the EEG. Next, I would like you to refer to your facilities instructor to be able to do a couple of mock patient studies using those troubleshooting skills that we discussed by deciding where the location of the error is with the high impedances, and then going on ahead and resolving them with a few troubleshooting tips. Your clinical instructor on site will be able to check you off for your assessment. Thank you for listening and good luck.